Heart valve disease in Black communities. Your views matter. We are Maba Daliko CIC. We are passionate about supporting our community to reduce health inequalities and empower you to take control of your health. We are a Black-led organisation and rooted in and for the community. Our mission is to amplify our voices and make sure that our needs are heard. Heart valve disease is a risk within Black, African and Caribbean communities in South East London, particularly for those who are 50 years old and older. We want to change it. We want to understand how well heart valve disease is understood in our community, how we feel about the care we might receive and the treatment options offered to us. At the end of this video, we will invite you to take part in a short survey so that your voice can be heard. Well, heart valve disease is a condition that can significantly impact the quality of life. It can also lead to more complicated issues, such as severe aortic stenosis disease, where valves become severely narrowed. 50% of people who develop this condition will die within 2 years if it is untreated. So what is heart valve disease? Our hearts are muscles that pump blood around the body. A heart is made up of 4 connected chambers. These chambers are connected by valves, which open and close to let blood flow through in the correct direction. Heart valves can become diseased or damaged for different reasons. It may be something that we're born with, or something that develops during our life, perhaps due to other medical conditions that affect the heart. If our heart valves are not working properly, it can make it difficult for blood to flow properly through the body. Symptoms of heart valve disease can include tiredness, palpitations in the chest, shortness of breath, swelling of the ankles and legs, chest pain, dizziness, and fainting. A stethoscope may be used to check for general heart health. There are 4 main tests that doctors can use to check if your heart valves are healthy. These tests are largely non-invasive and do not create discomfort. They include an echocardiogram, which produces an ultrasound picture of the heart and its valves, an electrocardiogram or ECG, which records the rhythm and electrical activity of the heart, a chest X-ray, which can show anything unusual with the size and shape of your heart, or a CT, computerized tomography scan, which produces multiple X-ray images to show the heart in detail. Many people with milder heart valve disease can live a normal life for many years with only occasional monitoring. If valves become more damaged over time, you may be offered treatment. You can discuss the advantages and disadvantages of each treatment with your medical team. You may need treatment even if you are not showing symptoms to prevent further damage. The final decision over which type of treatment you wish to have will always be yours. The type of treatment you are offered will depend on the condition of your valves and your general health. There are many successful treatment options for heart valve disease. Identifying it early can mean that we get the help we need before it's too late. Treatment may include medication or surgery, including a minimal invasive option called transcatheter aortic valve implantation, or TAVI. TAVI is a common procedure used to replace heart valves in adults. It is considered a minimal invasive form of surgery, less invasive than keyhole surgery, and recovery times are typically quicker than other types of surgery. TAVI is usually performed under local anaesthetic. A small tube is inserted into an artery through a small cut. This passes through to the effective heart valve. A new valve is implanted and works in exactly the same way as the original valve. After the procedure, most people are able to sit out of bed the next day. There may be some discomfort, which can be managed with pain relief medication. Many return home within a few days. It generally takes between 2 to 3 weeks to fully recover, but this can vary. You'll likely need to take some medication to avoid complications, such as blood clots, for a period of time after the procedure. The earlier that problems with our heart valves are identified, the greater our chance of reducing symptoms, enjoying a better quality of life, and living longer. Maber-Delico CIC wants to understand how well heart valve disease is understood in our community, and how we feel about the care we might receive and the treatment options offered to us. You'll be eligible to take part if you have Black African or Black Caribbean heritage, you live in South East London, and you are 50 years old or older. Keeping you safe will be our priority. The first part of our study is a survey that will take approximately 10 minutes to complete. If you are eligible for the study and complete our survey, you will be emailed a £10 One for All voucher. Your anonymous responses will be collected and kept confidentially by Maber-Delico CIC. No personal information will be shared with the NHS or any other organisation. You will be able to withdraw from the study without explanation, even if you have completed the survey. You will just need to let us know within 2 weeks of completing the survey. If you have any questions, want more information about how your responses will be used, or how you'd be able to withdraw, please email teammaberdelico@outlook.com. Find out more about us at our website www.maberdelico.org. In solidarity, the Maber-Delico CIC team.